A few years ago now, I was in recovery after a period of hospitalization for very poor mental health. I was no longer able to work in my previous career as a speech and language therapist, so I had no confidence at all at the beginning. I found it really hard to speak up, hard to believe I had anything to offer. But gradually that changed. And it changed because of staff who listened, who didn't get defensive, who were willing to try and find new and better ways of doing things. All of this helped my own recovery immensely because I finally had purpose. My suffering had value and meaning, and I could try and help change things for the better. My first involvement work was with the new Community Mental Health Framework in Oxfordshire, and I helped to develop more robust pathways through the mental health service for people with depression and PTSD. I also helped bring the voice of the service user to the development of the new Keystone hubs. And I was involved almost from the very beginning, along with some other experts by experience, as we're called. And I had to work quite hard to persuade them that this time it was different and their input was very much needed if it was to work and change was to come. I hope that the hubs will continue to develop and change in accordance with the feedback that they're receiving from public users, where that's possible anyway, especially I think in the first few years. There's still a little way to go to make them as good as they can be, particularly to make the delivery really consistent across the county. But they're exciting and they would have made an enormous difference to my own experience of services if they had existed 5 years ago. The other really significant involvement that I had in my first few years was helping to create this forum of patients and ex-patients and carers who could come together to work as experts by experience to help improve mental health services, and we call it Our Voice. I was the chair for about a year, and the forum has gone from strength to strength. It's now run by 2 co-chairs who are members, and members share with each other what kind of involvement work they're doing, and we have visitors come and we talk about projects or new services who want to recruit people with lived experience to help them work co-productively from the very outset. And I think co-production tends to be one of those things that people either assume they're already doing or they don't really understand what it entails, and so maybe they're even a little bit afraid of it. But really, it's not rocket science. And I think one of the main things to remember is that it's not just about gathering people's views or hearing their experiences. It's also about involving service users at every step of the way from the beginning and playing an equal part in the decisions and in the discussions that take place all the way through the process. When true co-production or co-creation is taking place, those of us with lived experience feel that we're being listened to and we have a real practical and important role to play in helping shape services, using our own experiences as the raw material that we can extract from. We feel valued and we feel heard. I think it's vital for recovery-oriented practice where patients are taking kind of an active role in their recovery because they're invested in the process, they're invested in the outcome, and they know that their voice and their experience counts for something, all of which contributes so much to their recovery. So one of the projects I became involved in my current role was co-produced care planning. So why is collaboration in care planning important? Well, for a lot of reasons. It provides opportunities for both clinicians and patients to understand the complexity of mental health, what it means in day-to-day life. So developing this completely new approach to care planning wasn't just about creating a new form, it's about changing an entire culture. It's changing box-ticking format to a sort of semi-structured conversation between the clinician and the patient that really feels person-centered, but which also provides the information that the NHS needs in order to keep things safe and evidence-based. It's so crucial to involve service users from the very beginning. It's not this kind of lip service thing where people are signed off at the very end of the process to say whether or not they like what's been done. But co-production is getting them on board right from the beginning